Councilman Greenlee, excuse me.
Thank you, Madam Chair. And I think that raises an important point. And if I may say, your opening comments were well taken on everything. I do want to point out for the record, though, that one of the committee members, Councilman Derek Green, had informed us a while ago of a longstanding commitment dealing with the issue of autism that he has been very involved with. So and I know he cares very much about this issue.
Absolutely.
Just a few quick things, and it's more just kind of emphasizing some of the things you said. Dr. Johnson, I'm sorry. I'm glad you pointed out that this bill is just not about the opioid crisis. The opioid crisis obviously is something that's the impetus because it's right out there now, but there's the issue of addiction, and I think it's been pointed out in some of these, it's been going on for a while with different drugs, and sometimes you don't know as you sit here today what will become a problem. Is that a fair statement? Or?
That's correct.
Okay.
And it's, again, as Dr. Grandy pointed out, it's not just drugs of addiction that are a problem. It's new drugs where long-term safety issues may not be well known. So this is about making transparency in the marketing of all drugs.
And that's why it's important to have that information that you're asking for, which is an amendment. I think you give them 60 days to provide that information.
That's correct.
Yeah, because you want to know kind of you want to know what the future is holding, maybe.
Right.
Yeah. Okay.
Drug marketing information is actually looked at by the FDA at a federal level, but the problem is the FDA does not need to report to us what they are approving for Philadelphia. So this bill attempts to give some local insight and into control of what's going on in our city.
And there may be some issues raised about, does the department have the capacity to handle this? You're here, so I think I know the answer, but just for the record, you say, do you have any concern that the volume of information that might come in might be, too much for you to handle? Could you talk about that?
No, well, first I have to thank you, because I love when council takes into account whether it's too big a workload for us to do. So thank you for that consideration. And this is a workload that we want.
Okay.
This is really something we feel strongly about. We do not think that this is a large volume of work, and I think it's something that we can easily handle. So thank you.
Just an estimate, how much information you think would come into you? Because I heard some estimate it could be millions of pages. That sounds a little over the top, but
the fact that I can't answer that question is exactly why we need this bill. Is that we were trying to figure out how many pharmaceutical representatives were working in Philadelphia. No one can give us an answer. We can estimate. So that question about marketing materials is a little bit of an unknown because we have no idea what's going on in Philadelphia.
Okay. Thank you. I'm sorry, I'll be real quick. A couple more questions, if I may, Madam Chair. Just, again, there was a letter put in, and you address this, Dr. Johnson, again, on your testimony, that, I don't know, maybe the individual didn't really read the bill. It talks about that there shouldn't be pre-approval of any material given out. There's no pre-approval of the material in this bill.
Not by the local health department. There are pre-approvals that are done at a federal level, but not
this
by
bill
us.
does not talk about pre-approval at all.
Not in this bill.
And it's obviously, as you state, not stopping any conversation that a doctor can have with a salesperson, right?
That is correct. It is, we encourage exchange of educational materials.
No First Amendment problem here.
That's absolutely right. All we want to stop are the bills.
And also, some issues have been raised previously about conventions, and there also will be amendments offered today that takes out these restrictions when representatives come in as part of a convention through the Visitors Bureau, or Convention and Visitors Bureau. Am I correct in that?
That is correct. We understand that conventions are important in Philadelphia and that we have no interest in impacting the conduct of convention business.
Okay. And real quick, Ms. Okendo, I see you obviously have read the bill. And in your description of what Temple asked for, your regulations are even stronger than this bill, correct? And you tell people where they can be and all that kind of thing, correct?
That's correct.
And to repeat what the question the chairwoman asked, you've still been able to function, right? And people have been able to talk to each other, and there's been no problem with that,
There
right?
have been no problems, and we partner with pharmaceutical companies for other projects like grants.
Maybe a little closer, Mike, just so we all can. Just pull the mic a little closer.
Thank you. Yes, we have them come in and exchange information freely with our physicians, and we partner with pharmaceutical companies for things like grants for our continuing medical education programs. It hasn't hindered our cooperation or our partnership with industry. Just
Okay.
have to follow the rules of the campus.
Okay, great. And finally, Dr. Greenlee, you mentioned, I think, a key word in your testimony. You say patients are twice as likely to report low trust in their doctor. And I would guess trust in your doctor is a pretty important thing. And that's probably one of the reasons you have these regulations that you do, which we're trying to put in with the city. Is that right?
Yeah, I mean, trust is really at the foundation of every doctor-patient relationship. People come to their doctor at a time of vulnerability, anxiety, sickness, and it is not the time to be needing to go out and second-guess, second-check every single decision that your doctor is making on your behalf or recommending to you. And so it's really essential.
I'm sorry. And that brings in the issue of perception, because I think there's reality that there has been pointed out in the testimony that the number of gifts and the number of prescriptions correlate in a lot of ways. But there's also this perception of both the patient themselves and also the perception of the general public. Is that a fair statement? That
Yeah,
the perception that if these gifts are being given out, maybe there's something not quite right here. Is that?
Yeah, I think that when you just look at the situation, I think any patient consumer out there would question why this exchange is happening. It wouldn't make sense to most patients about why we should allow that to happen.
Gotcha. Okay, thank you. Thank you, Madam Chair. Sorry, it took a little while there.